The specific chiropractic adjustment has been practiced for over 100 years. The first chiropractic adjustment was given by Dr. D. Palmer in Davenport, Iowa in 1895. The patient, Mr. Harvey Lillard, was almost completely deaf for many years after feeling something give way in his back while straining. After this first adjustment, his hearing was restored. The purpose of a specific chiropractic adjustment is to correct a lesion of the spine known as a subluxation. A subluxation of the spine is a misalignment or abnormal motion of the spine that causes a disturbance in the communication of the central nervous system with the rest of the body. This disturbance of nerve flow may result in less than perfect health and eventually disease. Chiropractors know as a general rule that a spinal subluxation will affect the nervous system. Through a specific chiropractic adjustment, a chiropractor can correct the subluxation and restore the spinal function, which results in improved health not only in the nervous system, but overall. The goal of a specific chiropractic adjustment is to reduce nerve irritation, improve range of motion, and improve the functions of the spinal column. A specific chiropractic adjustment involves the patient's vertebra receiving high-velocity, short lever arm thrusts. These will sometimes result in an audible popping sound, which is a release of carbon dioxide, oxygen, and nitrogen gases. This release of joint pressure may be accompanied by minor discomfort, but more often is relieving. Relaxation during a chiropractic adjustment usually alleviates any discomfort. The doctor may apply ice to the area, massage, or have the patient rest to aid in the relaxation process before a chiropractic adjustment. After a chiropractic adjustment, the patient may have increased range of motion, reduction of pain, reduced muscle tension, increased blood flow, a reduction in blood pressure, and an overall feeling of less stress. If pain or soreness is experienced, an ice pack or moist heat used as directed by your chiropractor can help. Often, rest and relaxation will aid in alleviating pain as well. Your soreness should only last approximately 24 hours. If you experience prolonged pain, call your chiropractor's office for advice and possibly to come in for another appointment.